When people are sick, they turn to their doctor for a timely and accurate diagnosis, but doctors often look to the results of diagnostic testing to make that diagnosis and to determine the best course of treatment. Diagnostic Services Manitoba provides all of Manitoba's public sector laboratory testing and diagnostic imaging in rural areas. Knowledge of the important role that diagnostics play in healthcare means that DSM is constantly striving for the highest standards of quality, because that is what keeps patients safe and results in accurate diagnoses.
We all know somebody who's had a lab test. We all know somebody who has had an X-ray or a CT or an MRI. Every one of those people are waiting anxiously for that test. We want to know that we're giving them the right answer. We want to know that the work we do is quality work. They want to know that when they get that result, they can rely on it and that their doctor will rely on it. Quality is the foundation of everything we do every day, with every test and for every patient.
Quality management in the diagnostic environment is incredibly complicated, as it involves specialized expertise in many medical disciplines and fields such as health and safety. But commitment to quality and patient safety from the top down is what drives a practical culture of quality care.
We have, as a board, committed to ensuring that we consider quality and patient safety in every decision that we make. That information, that the board has that commitment, is provided to the senior executive, to the management team, and to the frontline workers. And they know that patient safety and quality isn't just important to them, but it's important to the people who sit around that board table. And I think it has a profound influence on how they think, on how they make decisions, on how they prioritize, on how they communicate to staff, how they communicate to patients, and how they do their day-to-day work.
Quality and safety is so important to the DSM board that the directors convened a special body called the Quality and Patient Safety Committee.
Their mandate is to work closely and regularly with the CEO and some of the senior staff of DSM to look more closely at issues related to patient safety and quality, and then bring those issues back to the board with recommendations or decisions that we need to consider and perhaps make that will strengthen our commitment and the organization's work on patient safety and quality of care.
While the board is a driving force for quality, the evidence of that oversight is found in DSM's ongoing commitment to accreditation by third parties. DSM pathology laboratories hold accreditation status by the College of American Pathologists, which is one of the highest-ranking accreditations for laboratories possible. The remainder hold accreditation from the Manitoba Quality Assurance Program, which is run by the College of Physicians and Surgeons of Manitoba.
Accreditation is a very important process. Third-party accreditors come and look at your organization and evaluate your organization. Did you monitor the fridges? Did you monitor people's competence? Did you document people's competence? How did your performance proficiency testing? How has your equipment been performing? I'm proud to say that none of our sites have been cited a deficiency that the accreditors were worried about, that patient safety or staff safety was at risk, and have asked us to close that particular site.
While accreditors have never identified a patient safety risk requiring closure, they do find other issues requiring DSM's attention. These can be issues related to infrastructure, documentation, or processes. The accreditor's recommendations are taken to heart, and solutions found within the time period given by the accreditation programs. And sometimes they are even addressed right on the spot.
If there's a problem, we'll actually identify what are the changes that need to happen right away, and what are the changes that need to happen system-wide, because we want to make sure that similar issues don't come up in other parts of the system.
Accreditation is a symbol of DSM's attainment of high standards of quality that keep patients safe. But quality is not something that is just achieved for an accreditor's visit, then forgotten about once the papers are signed.
There is no single point in time that all of a sudden we start to prepare for accreditation. That's not how this works. It's a constant moving platform for us. We're always preparing because we're always looking at delivering quality results. We're always looking at improving our quality systems. We're always looking at how can we do better. And in that way, we're always preparing for accreditation.
Accreditation, despite its importance, is only a small part of DSM's quality management system. Another significant activity in that system is external proficiency testing.
What the objective is for a third party to send us specimens. They're marked specimens that are labeled the same way as a patient specimen is labeled, and you put that specimen through the same process as you would any patient specimen, except the result is not reported to a physician as you normally would do. It is reported to the third party, and the third party evaluates how you perform compared to your peers. And we are part of the College of American Pathologists process in proficiency testing, and our results have been very, very competitive.
Like accreditation, external proficiency testing is provided by external agencies. Internally, DSM has many activities, policies, and programs that help to keep patients safe and to deliver quality diagnostic testing. For instance, there are internal audits, training and mentoring programs, and document control that ensure staff are kept up to date on policies and procedures.
DSM takes patient safety extremely seriously, which is why we have over 5,000 standard operating procedures, all the way from identifying patients properly to making sure we're releasing the results to the right ordering physician. So we have a large system. We deliver millions of results every year. So it's critical that the system that we build is reproducible. So every time we greet your mom or your dad or your sister and draw blood or take an x-ray, we're following a very routinized standard operating procedure that allows us to deliver that result at the right time, at the right place.
But no matter how well written the policies are, how well maintained the equipment is, or how detailed the quality system is, ultimately, quality depends on the experience and ethics of the people doing the work.
We have programs for monitoring that people maintain their competencies, their credentials. We do continuing education so that they can remain current. So we have a very robust program for the qualifications, credentials, continuing education, and certification of our staff at all levels. And of all of the things that keep me awake at night, the quality and safety of the work done by our frontline staff is not one of them. So I have absolute confidence. I know that every one of those staff come to work wanting to do the right thing for their patients.
As confident as DSM is in its staff, there are times when errors do occur, whether by human, procedural, or technical fault. And rare as it is, sometimes patients can be harmed when errors occur.
When a patient is harmed, when an error occurs, DSM acknowledges that this has happened. And the regret that DSM as an organization feels when there is an error that causes harm to a patient is deep and goes through the organization. It's felt at every level. The most important thing for an organization to do when that has happened is to reach out to the individual who has been harmed and his or her family and express that sorrow and regret that it's happened. And then to look at why the error happened and in every way possible fix the system. And then we apply that learning not only in that specific situation, but in every situation where that mistake possibly could happen. And we use it for training, we use it for learning, we use it to help us move on.
While every error is terribly regretful, Manitobans can find assurance overall in the fact that millions upon millions of diagnostic tests are performed each year. But critical incidents, situations where patients are harmed, are very rare. This low rate is due to the quality management system that DSM has in place and to the diligence and caring of the people working in it. But patients also have a role within this system for ensuring their safety and the safety of their loved ones. If there are concerns about quality or safety, or even the service received, they can reach out to DSM Client Services.
We do thousands and thousands of imaging procedures and millions of lab tests every year. And every one of those is a person that we need to look after when they come to us.